Health experts in and around Fiji are warning if the Delta variant of COVID-19 keeps mutating, a new vaccine may be needed. More than 20,000 people with COVID are in isolation, and the death toll has passed 250 and climbing. Christine Rovoy reports.
The U.S. Centers for Disease Control and Prevention has this week placed Fiji on level 4 of its COVID alert due to the growing number of cases in the Pacific nation. Professor Fiona Russell from the University of Melbourne says reports that more people are dying from the virus in Fiji should be a concern. At least 200 people, including a baby, have died due to COVID since April this year. Professor Russell says the mutation of the Delta strain could happen.
That is a characteristic of all viruses, not just the COVID virus. And there's other mutations that have already occurred, such as the Lambda variant. But at the moment, what we've found is that the variants have become more transmissible. We have to keep an eye on that. We need ongoing studies to monitor it. And it may be that in the future, people in Fiji may need a booster with a different vaccine or something.
New Zealand epidemiologist and University of Otago Professor Michael Baker agrees, saying Fiji is going backwards in its fight against the pandemic.
The situation in Fiji is very worrying. They've really lost control of this epidemic at this point, given, as you say, record numbers over the weekend, its very widespread nature.
Fijian epidemiologist Dr. Donald Wilson says the country is overwhelmed by the pandemic.
The worry is because when the health system becomes overwhelmed, when it cannot any longer take in lots of patients who've got severe disease, then unfortunately, like what has been happening in other countries where doctors have to do the unethical thing of needing to choose who to put on ventilators and who not to.
Despite the Fijian Prime Minister's refusal to enforce a national lockdown, Professor Michael Baker says it's not too late for the government to change its strategy.
It depends on what their overall strategy is. If they want to return to an elimination position, I think they need to act very decisively now. And that actually offers a much better route back to economic recovery than trying to suppress the virus and live with it, which hasn't really worked very well in the past.
Close to 500,000 Fijians, or 83.7% of the target population, have received their first dose of the AstraZeneca vaccine, while just over 150,000, or 25.9%, have got both jabs. Head of Fiji's vaccination task force, Dr. Rachel Devi, says the only good news is the Moderna vaccine now in the country is also effective against the Delta variant, the UK variant, and the Wuhan strain of the virus.
We have important strategies that we're planning right now, and we'll release them very soon in terms of how, when, where we roll this out across the country. This will definitely boost it up, especially right now we weren't vaccinating our pregnant women with the AstraZeneca unless obviously individuals consented. But I know there's quite a lot of build-up in that area now. There's a lot of evidence on safety reasons as well.
Meanwhile, an Australia-based Fijian academic warns Fiji is suffering its worst medical, social and economic crisis since the measles epidemic of 1875, which led to the deaths of a third of the country's population. Professor Wadanasi says this could have been avoided had the government listened to the best medical advice, not just in Fiji, but also from its major partners, New Zealand and Australia.